Historical developments of community health nursing in the world. Ancient period. The history of public health and public health nursing can be traced far back in the past. In earliest times, people struggled for their survival by devising their own methods to deal with life events such as births, deaths, etc. People were concerned about diseases and had some knowledge of its treatment. Medical care was given by religious leaders or priests who were revered by the society. Record history of ancient civilizations such as Babylonian, Hebrew, Greek, and Roman reveals that they possessed knowledge of personal hygiene, community responsibility and medicine. They had well-developed system of environmental sanitation such as safe water supply, drainage, and sewage disposal system. They also had understanding of contagious nature of diseases. This resulted in rigid public health measures like isolation of the sick, quarantine of the families and sometimes of the communities. The philosophy of the time was that the individual should provide for the basic needs for himself and his family. His responsibility included the provision of food, shelter, and clothing and care in case of illness. The community responsibility was to protect the individual and his family against illness that might be due to communal life. History of public health and public health nursing in Britain. The development of modern public health and nursing took place from the middle of 19th century both in England and America and various other countries as a result of occurrence of great epidemics of bubonic plague, leprosy, smallpox, cholera, etc. During 18th century and early 19th century England faced industrial revolution which created tremendous social impacts in terms of socio-economic imbalance, exploitation of workers, slums, overcrowding, poor sanitation, broken families, child abuse, maternal and child health problems. During 19th century, in spite of the Act being passed and implemented to improve the environmental sanitation, these diseases continued to occur again in the Western world. This was because of the fact epidemiology of the diseases were not fully understood. Ms. Florence Nightingale has been recognized as one of the foremost pioneers in the public health and public health nursing movements in England. She is acclaimed as the founder of modern nursing. She began her work when nursing services which were established by religious order, had withered away with the decline of church power and influence. She began her work when nursing services which were established by religious order, had withered away with the decline of church power and influence. Florence Nightingale created an atmosphere of dignity and self-respect for nursing. History of public health and public health nursing in America. In America, similar developments took place in the field of public health and public health movement gained momentum in 1850, when Lemuel Shattuck, a publisher and bookseller, submitted a report on sanitary conditions of Massachusetts to its legislature and also published the same. In his report he put forward specific recommendations regarding a system of sanitary inspection, collection of vital statistics, school health program. In 1872, American Health Association, a national-level profession organization of community health workers was established. This association initiates various public health campaigns and has consistently worked for improving standard of community health services. The field of public health branded under the influence of scientific advances in microbiology, social and behavioral sciences. Thus, in late 19th century and at the beginning of 20th century a new concept began to take impetus that state has the direct responsibility for the health of people. Public health activities not only included the activities of improved sanitation and control of communicable diseases but also preventive and promotive services to mothers, children, school children, workers and elderly. The need for the application of principles of personal hygiene, care, and health services for controlling mortality and morbidity among mothers, children and workers, etc., and improve and promote their health. This phase of public health gave origin to public health nursing. During this period, the foundation of district nursing through private, voluntary efforts was laid. By 1890, 21 such organizations existed in USA. In 1893, Lillian Wald, the pioneer in public health nursing, founded the Henry Street Settlement, which grew into a well-organized health center with visiting nurse services for the surrounding community. The Rockefeller's Foundation of New York, established in 1913, adopted public health as one of its fields of interest. This foundation assisted in establishment of schools of public health in United States and other countries. The American Red Cross Society, the Commonwealth Fund and Kellogg Foundation were the other voluntary and private bodies which were very active in the development of public health and public health nursing services. During the early part of 20th century, there were specialized nurses in the field of public health, like nurses in maternal and child health, venereal diseases, other communicable diseases, tuberculosis control, etc. Public health had entered a new era. It was faced with new emergent health problems which were more serious but chronic and degenerative, such as cardiovascular diseases, cancer, stroke, mental illness, and metabolic disorders. Thus, public health dealt with wide range of health problems, and its activities moved beyond the traditional basic 7 services, which included communicable disease control, environmental sanitation, maternal and child health, health education, medical and nursing care, nutrition, and vital statistics. The field of public health broadened. Increasing emphasis was given on primary healthcare and preventive and promotive services, further as a result of Alma Ata Declaration of the Goal of Health for All through Primary Healthcare by WHO and UNICEF in 1975. Historical developments of community health nursing in India. Ancient period. The development of public health nursing in India started much later as compared to developed countries of the West. But public health in India was in practice much before its development in Western countries. The Indian history revealed its public health practice as early as 5000 BC. The period can be classified as Vedic period and post-Vedic period. During the Vedic period, the sacred books Upanishads and Vedas, especially the Atharva Veda, documented all the knowledge about medicine, personal hygiene, prevention of sickness, etc. The post-Vedic period, 500 BC to 700 BC, started with the rise of Buddhism. Buddhism embodied the principles of non-violence, helping the sick, poor, and needy people, self-discipline, self-education, charity towards all men, etc. British period, 18th century to 1947. The British had established its rule in India in 1757 by establishing civil and military services. In 1859, the administration of India was taken over by the Crown from East India Company. In 1859, a royal commission which came to India to study the problem, recommended to establish sanitary commission of 5 persons each in Bengal, Bombay, and Madras. In 1896, following the outbreak of epidemic of plague, a plague commission was set up to investigate its epidemiological aspects. As result of investigation and suggestion, in 1912, the local government bodies were made responsible to execute various health services according to overall plans and directions of central government. In 1939, some very important developments took place. The Madras Public Health Act was passed for the first time in the country. The first rural health training centers was established at Singur near Calcutta with the support of Rockefeller Foundations. In 1943, Health Survey and Development Committee existing health conditions and health organization in the country and to make recommendations about the developments in future. Development since independence, 1947 onwards. Before India attained independence on August 15, 1947, some of the provinces and princely states of India were parted to constitute Pakistan. This affected change in demographic, political, and socio-economic aspects. At the same time, a large number of people from Pakistan migrated to India. The government of India at that time faced a large number of socio-economic and public health problems. But because of new constitutional policies and the enthusiastic attitude of political leaders, administrators, and the people in general, the government could manage to overcome initial difficulties, implement strict public health measures to prevent epidemics. Planning Commission was constituted to help government to plan out integrated development plan for the entire country within the available resources for a defined period of 5 years for its socio-economic progress. The Planning Commission has been responsible for 10 5-year plans. Please like, subscribe and click the bell icon. Thank you for watching video.